All right. So, welcome to another free weekly Zoom Wednesday, as we do um, for you all for free. Now, a lot of people ask me, well, Dr. Z, you're doing Ask Graph again, you're doing the method again, you're doing NIPA, you're doing needs. Yeah, I'm doing it again. For those of you that have not never been here, that don't follow us on our social media, the reason why we're doing this is because we just created brand new questions that are going to show you how these are going to be made on your board exam, and then on top of it, how it's going to be presented in next gen as well too. I'm going to talk through it, so be ready to take some notes. Again, it's all free material. In the meantime, we do have some people that crossed over to the other side. So I'm going to start with somebody that just joined us right now. And with that said, we've got Nurse Brittany here. Nurse Brittany, how you doing?
Hi, everyone. Hi, Dr. Z.
Hi, how are you? So, Nurse Brittany is one of our top educators here. Whoops, why did it stop doing that? Hold on. Oh, okay, here we go. Sorry. All right, so Nurse Brittany, there we go. There's Nurse Brittany. Okay. Sorry, I was sharing my screen before I was doing that. Nurse Brittany
It's
is one of
okay.
our top educators, teaches all types of stuff, reproductive, maternity, respiratory, neuro, so on and so on and so on. One of our top tutors as well, too. Nurse Brittany, you had one of your students that crossed over to the other side, and you are rocking what this individual has now become. Do you want to flex that
Oh,
shirt?
yes.
It's the nurse
My
shirt.
favorite shirt.
So yeah, we just dropped that shirt as well too. We just dropped that shirt. Nurse Brittany, who is your student?
So Nikia, are you here? I
Let
saw
me.
her right in the
Oh,
chat.
and there we go. I got it right here.
Awesome.
Here we go.
Nikia, are you there?
Hi, Nurse Brittany.
Hi, how are you?
I'm good in you.
Good, good. Congratulations.
Thank you. Thank you.
How does it feel to be on the other side?
Great. It's like the elephant is off my shoulder.
Oh, good, good. I know that feeling. What did you use at Nclex High Yield, if you don't mind sharing?
I started with the free Zooms and I noticed that wasn't enough. So I joined the May June live course and I was with you guys.
Okay. Awesome. Awesome. How many questions did you get?
I did the whole exam, the 150.
The whole exam.
Yes.
Okay, well, a pass is a pass, right?
Yes. Yes. Yes.
Any advice for people on the other side?
I'll say because before I found you guys, everyone was telling me just do questions, just do questions. And if you don't know your content, the questions is not going to be very helpful at all.
Yeah.
So
100%.
joining the course, the content was more than enough. It got me through. I did the first 30 questions and I was like, I got this. I got this. After that, the test was just flying. It was coming to me. And all I heard was Dr. Z, what are you freaking out about? So it was a good thing. It was good.
So
Joining the
Dr.
course
Z
was,
is on your shoulder.
yes, he was on my shoulder. He was.
Awesome, awesome. Well, we're so proud of you. Thank you for sharing your
Yes, yes, we
story with us.
are. Nurse
Thank
Nikia, just
you.
just out of curiosity, what would did you think that the course was an investment that was worth? I know at that time, it was a little bit pricier because I don't think we had an early bird special at that time. So, would you say that just not only for your boards, but moving forward as a nurse, how do you feel about it?
I'm going to say the course itself is going to make me a better nurse, and to the point that I just pay for my friend to be in your course. So it's very,
Wow.
Oh, that's
yes.
amazing.
Wow, that's amazing. Well, that's paying it forward if, wow, that's amazing. That's amazing. Well, well, I mean, wow. Well, I've met a loss for words. That was awesome. Well, we are very proud of you. And
Yeah.
again, you're welcome to the other side. You're gonna make what you invested in yourself and what you've helped somebody else do in no time at all. No time at all. So we're so proud of you.
Thank you.
Thank you for sharing your
Congratulations
journey.
again.
Yeah, congrats. All right, that was amazing. That was unexpected, but that was
Yeah,
amazing.
that was awesome.
Absolutely. I love our community. Our community is just on another level.
Yeah.
Just the support that we get from all of you all is, I mean, again, lost of words, right? So,
Yeah.
Nurse Mariama, where are you at? Oh, there we go.
Hi, everybody.
Hello.
Hi, how's everyone?
We are doing well. It's another free Wednesday, so we can't go wrong. So, Nurse Mariama, what did you use for of Nclex High Yield?
Okay, so for Nclex High Yield, I had the live course, and I have access with the live to the on-demand course that followed too. And I've also used UWorld that's what I took advantage from Nclex High Yield.
Yeah, absolutely. I think the one thing that we've kind of kept consistent is that less is more, and when you use Nclex High Yield in UWorld, it's pretty much a wrap. You know, as long as you utilize it to its fullest. So, what attempt was this for you?
This was my second attempt.
All right, so there you go. And how many questions were we?
I had 150 questions. I had it
You
both
got
for my first attempt and my second attempt.
So again, the amount of questions you get does not determine a pass or a fail. Clearly,
Nope, it really
it sure
doesn't.
doesn't. How did you feel using the course and utilizing on demand and actually utilizing UWorld with everything that we've taught you? How did that feel when you were taking the exam?
I felt more confident going in because I will say, like, when I took my first attempt, I was a bit more nervous. And like you mentioned, I had this expectation, like, okay, I felt like 85 questions would have been fine. I'm out. And I noticed
Right.
I got more anxious as the content questions went on, and I noticed I had a whole test. And I remember, as you mentioned throughout the whole live course and on demand, you're like, if you get past that 80 question mark, just keep going, keep pushing. And I felt that content was a big part for me because I remember I just kept doing questions after questions after questions my first attempt, where the point I noticed I got exhausted. And then
Mm-hmm.
as previous speaker and previous nurse mentioned, it's important that you know your content and know what you're focusing on. And I know
100%.
time around the advice that you have given me, Nurse Brittany and Nurse Megan has given me, you all mentioned that it's important to focus on areas, at least focus on areas that you feel that you're least prepared for or that you need to work on. And then that's what I
Absolutely.
noticed that I needed to work on. So that's like I spent the whole entire last week working on those questions, working on the content. And I spent less time on questions and I reviewed the material first and making sure
Absolutely.
I understood it.
You can't get through. A lot of people don't understand that you can't get through this exam without content. And
No.
that's the biggest takeaway. So, Nurse Mariama, what is your advice for people on the other side?
So what my advice to tell people is that to keep going and to keep pushing yourself and never compare yourself to anybody. Because another thing I took away from advice that you've given, whether it was content or non-content based, is remember that we are doing this in our own time and to
Yeah,
never compare
excellent.
yourself to anybody else. Some people may finish earlier, some people may finish later than you. And
But finish.
another thing is I mentioned, like I recommend is to take breaks.
Yeah.
Always take breaks, and because sometimes you overexert yourself, and I noticed that
Mhm.
that's what I've been doing, and
There
it's
you
so
go.
that you have to take those breaks, and
Absolutely.
it may feel like you're studying forever, but remember that at the end it'll be all worth it in the long run.
Yeah, well, you're here, and it was all worth it. So we appreciate you sharing your story with us, Ms. Mariama. Congratulations again, and
Thank you,
welcome to the other side.
everyone, Dr. Z and the whole entire team. I
You're
really, really
very welcome. You're very welcome. Next up, we've got Nurse Tiffany, Nurse Brittany. This was another one of your students. Look at you on a roll
Yeah.
today alone. I mean, you are on a roll every day, but still, here we go.
Tiffany, are you here?
Hey, Nurse Brittany.
Hi, look at that smile. How
Yes,
are
girl,
you?
I am here. Uniform ready.
Amazing. I love to see it. That's awesome. Well, congratulations. We're so, so happy for you.
Thank you so much. You were amazing.
Aw.
Nclex High Yield is amazing. You know, I'm not getting paid for Nclex High Yield. I am just being honest and truth. This is not a
Aw.
paid promotion. Listen, it works. I was from podcast in my ear, cooking, driving, whatever. I was doing it. Um, And Nurse Brittany was like, let me see your scores. And look, we had so many health mishaps Saturday and Sunday, but she kept staying the course and with me or whatever in my tutoring session. And she was like, let me see your scores. And so my scores went up there. You know, I had Archer, but listen, y'all, do not fret. I'm telling you, do not fret. Keep trying. The podcast. Look, you ain't even asking me no questions. I'm just going on and on. I'm so excited. Let me stop and
That's
pause.
okay.
Dr. Zishan probably said she crazy.
No, I mean, hello. That'd be calling the kettle black. Like I am. Hello, look at me. No, so absolutely. I mean, look, you work with Nurse Brittany, used Nclex High Yield. Clearly, you've made it very clear it's not paid promotion. But just out of curiosity, what attempt was this for you?
This was my third attempt. So I felt Peter when I saw his message there. You know, after that second time, I was down and depressed. I didn't want to do it anymore. I was like, and that test killed me. And so I was like, okay, I can't give up because I know I am destined to do this. I know I have the heart and the compassion to do this.
Oh
And
yeah.
so I just got in my mind, and I'm not gonna lie to y'all. Listen, I wasn't one of the ones that rigorously said that I did. Okay, so I did the live course, yes. And then I failed off because I work and all of that stuff. But I did the live course. But then I fell off. I started slacking. I didn't do just stay consistent. I'll say that. Then I was like, okay, I got to get back on this horse. I would not lie to you. 30 days consistently listening to that podcast, reviewing those my on demand, because you have
Oh
on
yeah.
demand. If you buy the live course, you have on demand forever. And look, when I email Nurse Brittany and told her, I'm like, can I use this for RN or whatever? She's like, yeah, you can use it. You just have to pay a little bit of fee, but you can use it, girl, or whatever. So
Yeah.
I was like, I'm using this all the way throughout RN school because it gives you so much content. It helps you understand. And then Nurse Brittany was like, okay, well, I'll tell you what. She was like, you know your content. I can see that. She was like, at first, I felt like you didn't know your content because of your scores on Archer. But because I was like at what, Brittany, like 50 something,
Yeah.
50s.
Mm-hmm.
So she was like, so I tell you what, you know your content or whatever, but I did mess up on the baby question, but she corrected me on that one. But she was like, so do this. Maybe try doing a U World readiness assessments for $20, right?
Yep.
So at first I was like, I ain't gonna do it or whatever. Then I was like, okay, it's probably about 8 o'clock at that night. And they tell you don't do any questions, but I was like, I
Oh
just had to
no.
know. Yes. So I ain't
You know
telling
I
y'all to
say
do
not to
this,
do
but I'm
it.
saying what I did. Listen.
Yeah,
So I
no.
paid the $20, 8 o'clock at night. My test was 8 o'clock in the morning. So
Oh
I'm
no.
going through that on the U World Readiness or whatever. And like maybe question 60 something, maybe 67, I kind of stopped because I didn't want to get overwhelmed. So I kind of
Right.
stopped. But my score was good. So
Yeah.
I went in, not to say that I went in so confident, but I went in assured. And then Nurse Brittany had just gave me, so much positive feedback or whatever. She was like, you know your content, just breathe and just take your time and answer the questions.
You
Y'all
got
listen,
this.
Yeah,
apply that
absolutely.
axe graph to every question, and you will
And
not
that's what we're
fail. I'm
about to
telling
do
you.
today. That's exactly what we're about to do today is Ask Graph. But real quick, while we wrap up here, how many questions were you real quick before we wrap up?
I had 119 questions.
119. So again, just to reiterate that we don't have a set amount of questions before you passed or not. So with that said, that's amazing. Look at all the different things that we're hearing from different stories, and I love your vibe. Like it's intoxicating. Everyone in here is just loving it. Storytelling at its finest. So with that said, Nurse Tiffany, congrats. Welcome to the other side.
Congratulations.
Uniform and all. Let's go. We will talk to you soon and keep us posted on what you're doing.
Thank you for sharing
Thank
with us,
you.
Tiffany.
Good luck to everyone.
Thank
Congrats
you, Nurse
again.
Tiffany. And last but not least is Nurse Sandra, who just popped up in here and said, I need to tell my story for 1 minute. Just 1 minute, Dr. Z. I need to tell my story for 1 minute because I just passed. So, Nurse Sandra, drop us with that 1 minute real quick. What
If I did not talk to you today, I will be like, Dr. Z, I've been waiting to talk to you from August. I joined your class in April. You remember the night that I spoke to you and I cried. And I said, the day that I found you, I knew that this is my time.
Yeah.
Dr. Z, I was in the live class from April. I was in the class of April. And then I attended every class with Nurse Brittany, with Nurse Megan, with you, every class I was in. While I was at work, I was logging in. And I said, you know what? My problem was the content. I realized that I did not have any content. Dr. Z, I went in and decided that I'm going to go and take this exam. Dr. Z has been saying every day that you are a nurse already, you got it. Dr. Z, I went in there on the 1st of August, and I said to myself, Sandra, be confident, you got this. I could hear Dr. Z's voice in my ears.
Yep.
All the minute I sat down, I got all my nurse graphs written down, my NIPA, I wrote all of that on the side. And I sat down, I was calm. I said, if it's 150 questions, I'm doing this. I'm ready for it.
Right.
Every break, I took my breaks and I went 85. I went, keep going, 100, I keep going. I said, I'm still here. I went up to 130 and it cut off. On the 2nd of August, I found out that I passed. Dr. Z, I screamed your name so high at work that everybody was asking me, who is this Dr. Z? I said, he is the man who has brought me to this. Dr. Z, I want to thank you so much.
You're very welcome. You're very welcome.
And just to tell everybody in this group, whether you are new or you are old, listen to Dr. Z. All you need is Dr. Z and you will.
Thank you.
The money, Dr. Z, I borrowed a credit card to pay for my course.
Right.
It is well worth it. Thank you so much.
You're very welcome. Thank you for popping in today, Sandra. That was a very nice surprise. So thank you so much for sharing your journey. And look, everything we're going to get started on right now, you better know it. Thank you, Sandra. Thank you again. All right. You better know this stuff. You better know it inside out. Why do I do this so much? The one thing that you will learn about myself and everybody that's in Nclex High Yield is that repetition is key, but not repetition as in memorization, repetition, but understanding and application. So right now, whether you're winding down the year and getting ready to take this exam in the next couple of days, or you're just saying, you know what, I want to be proactive and I want to get ready for 2024, let's get this. This is the foundation. This is the foundation of what you should know. And those of you that have already seen this before, watched this before, it's all good. There's nothing wrong with hearing it again, especially because I got some brand new questions right here made in the last 24 to 48 hours that are going to be board style questions. I'm going to show you how they're used and how we're going to use everything that's there. The first thing is you need a method on answering the questions. And the method is basically a way to keep yourself organized. Using the last part of the question first, I'm going to demonstrate this more than talk it out. And that's because of the fact that it's easier for me to demonstrate how to use the method than to just say it when, if you actually see it in action, it'll just be a lot better. But I promise you this. The things I'm going to talk about today, ask graph. Okay, those of you that know it, great. Watch new questions pop up. ASH, NIPA, needs. Watch the importance of these. Watch the importance of these. Because I tell all my students that are in the live course, I go, look to your right and look to your left. I go, chances are these people don't know what ask graph is. They don't know the method. They don't know ASH. They don't know NIPA. They don't know needs. They haven't started thinking like me. Those of you that are in the course or in the courses or on the on-demand, how many of you have started thinking like me? How many of you can sit there and say, oh, the boards can not only ask this question this way, but they could probably ask it this way and this way, or maybe related to another subject or another system? How many of you are feeling like that are in the course? Yeah, it's mind-blowing. And then you're like, well, that's just easy, Dr. Z. I was like, not for this person and not for this person. So now you're like, well, I just answered this question. I go, but I bet you this person and this person didn't get it right. What is ask graph? Ask graph is my claim to fame. Ask graph is, in my opinion, arguably one of the best things that you can find when it comes to prioritization. Prioritization is going to help you in real life, and it's going to help you on your boards. How many people know what ABCs are? Everyone knows what ABCs are: airway, breathing, circulation. I kind of joke about this, but I'm sitting there and I'm kind of like, all right, so ABCs, airway, breathing, circulation. Well, I know for a fact airway is number one. Like, there's no doubt in my mind that if someone's airway is compromised, I am freaking out about it. Freaking out about. Or FOA. Freaking out about. Whoops, why did it go to? Hold on a second. I don't know why I did potassium. Airway. So airway, airway, airway. I know that. So ABC is cool. Because maybe that works in real life. Or maybe it worked for you. Maybe it does work for you. It didn't work for me in a majority of my students. You know, they were like, wait a minute. Okay, airway, but breathing. Okay. Circulation seem kind of vague. I kind of feel like ABCs are like we know airway, 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 and they were like, all right, so how are we gonna remember airway? And then like some other stuff, and like a bunch of people are kind of sitting around. They were like, oh yeah, let's do ABC and throw in breathing. I don't really understand the difference between airway and breathing. Can you be a little bit more specific? Or circulation? Well, that's still a vague term, right? So I just wasn't convinced. I was like, you know what? I'm not convinced that airway, breathing, circulation works for me, nor is it working for my students or majority of my students. Instead, I was like, well, wait a minute. As I took my boards and my next set of boards and my next set of boards, and then I taught boards, and then I taught PAs, and I taught nurses, I looked at all the boards and I was like, there's a pattern here. Airway above all else. But breathing and circulation didn't pop up. But you know what did? Sepsis, changes in potassium, glucose being less than 70. If we don't have sugar in our body, do you think our metabolic pathways are going to work? No, we're going to shut down. We're going to become comatose. In infants, I was like, well, how do I figure out an infant has any issues? They're going to be described. And the descriptors are lethargy and grunting. You see those two words in peds, you're questioning it. You're like, why are they grunting? Why are they lethargic? You're probably freaking out about it. A is altered mental status. P is peritonitis. And H is hemorrhage. I'm going to go into these a little bit more in depth, but I do want to show you some practice questions. So let's get started. Ooh, before I do that, sorry, I have a few announcements. I totally lied. We're going to get to that question real quick. I'll talk about peritonitis, don't worry. All right, January course is almost full, so get in while you can. $4.99 is like the cheapest I've ever seen this in this company. So jump in if you can. Okay. Again, if you've taken the live course previously and you want to re-enroll, we have that available as well too. Just email us for more information. So just go, there's a re-enrollment option available. Just email us or fill out the thing as well to fill out the Google form. The on-demand course, 45-day, obviously is available. We have the $99 one if you want to get started or you're in a rush as well too. But again, we have lots of free resources. So make sure you follow us on Instagram, YouTube over here, Facebook group, on TikTok. Follow us everywhere and you will get all this information repetitively, and our podcast as well too. Be aware of scammers. We don't use Zelle, Cash App, Telegram, Discord. Do not fall for it. And then today, I will be doing a question and answer session as well too. But check this out. A lot of people have a lot of questions with moving forward, first-time test takers or repeat test takers. You're in the same boat because you don't know what to expect. I will personally pick up the phone and call you. In the next 24 hours for those of you that fill out your the Google form and or email us. If you're interested in re-enrollment or you are interested in the upcoming course as well too. So again, if you're interested in re-enrollment or the upcoming course, I will personally call you in the next 24 hours. It will come on a first come, first served basis. So once my time is allocated, and although a lot of time is done, then I will not be doing it, but somebody else will reach out to you, whether it be Nurse Brittany or Nicole or anybody else. But I'm going to try to get to as many as I can. Again, it's first come, first serve. Sorry, I forgot the announcement. So with that said, all right. So with our Ask Graph, prioritization. So my question to you is this. If I have old gen or traditional questions, what about next gen? Do you think next gen has prioritization questions? Yeah, it absolutely does. Because what about the things that are important to us? Airway, sepsis, changes in potassium, glucose. Yeah, they're going to show up on there. Is this information just for PNs or just for RNs or just for a PA or an MD or a DO or an NP? It's for everyone. Our courses for the Nclex are catered towards PN and RN, but this is stuff that everyone that has used that I've taught. So everything that we teach in our courses is for PN and RN, and this is very important, right? So now we're going to use the method. The method is using the last part of the question first. Which of the following patients requires the most immediate attention? Again, first, initial, priority, urgent, most concerning, immediate, report to HCP. Do you see these 7 words I just said? Watch it on YouTube. Listen to it on the podcast. Come to the Zooms. It's always there. You got to pick out that word like this. If you can't pick out that word that quickly and don't know that this is a prioritization question or one that we're freaking out about, you're going to sit there. Prioritization. Sorry. You're going to sit there the whole time and be like, okay, cool. All right, immediate. Okay, something. Let me see what I'm going to do here. All right, nurse in the emergency department. Cool. Is triaging several patients. Okay. Right off the bat, do you see how I did this? Immediate. I know that this is one that we're freaking out about. What am I looking for here? Ask graph. It's very simple. I'm looking for one of the 8. Good. I'm looking for one of the 8. Airway above all else. But let me see if I can find something that falls into Ask Graph. I start with number 4. Do I make a decision with number 4? No, I just compare it and watch my students that are current students. Watch how they answer this question. I start from the bottom and I just compare it to number 3. That's it. Am I looking at 2 or 1? No, not yet. I take number 4 and I compare it to number 3. So a patient with a history of COPD, complaining of increased shortness of breath and wheezing since this morning, or a patient with a known peanut allergy who is experiencing a mild rash after eating a dessert. Ooh. Why keep 3? Keep 4. All right, somebody tell me. 3 over 4, 4 over 3, 3 over 4. All right. I made this question on purpose. How many people, now this is where content comes in, okay? This is why I said this lecture is, every time I teach this, it's going to be a little bit different. I'm going to teach you more and more information. I said that in a patient that has anaphylactic reaction, what is the word they're going to use? What is the word they're going to use? Hives, right? A mild rash or just the word hives? Which one am I freaking out about? Mild rash or hives? Hives. A mild rash, is that attributed to peanuts in like right in the situation? No, a mild rash could be anything. It could be they're allergic to dairy. Who knows? Do they say anything about airway compromise? Are they having wheezing, swelling of the tongue? No. No stridor, no tripod position. I put this in there on purpose, right? If they have hives all over them, now I'm like, wait a minute, this could be something that we're freaking out about. But increased shortness of breath and wheezing, guess what's starting to happen to this person's airway? It's exacerbation. Is exacerbation airway? Yes. Yes. Absolutely. Even to the extent, now let's take this one step further. Let's just say it did say hives. Let's just say it did say hives. Am I going to choose hives right away over increased shortness of breath and wheezing? Probably not. Why? Have I indicated that their airway is compromised? Not yet. Not yet. You see the difference here. Not anaphylactic yet. Could it turn into anaphylaxis? Yes. Does hives scare me? Yes. Is this person's airway compromised just because they have a peanut allergy and develop hives? Not yet. Is this person's airway compromised right now? Yes. Do you think the boards are going to try to get you like this? 100%. This is that question where this person and this person are going to be like, peanut allergy, mild rash, boom, I'm choosing it. You see? Right now, it seems like, okay, I get it. It's not that hard. But again, look to your right, look to your left. They're not going to know exactly what I'm teaching you. So hives doesn't indicate airway compromise. Does it scare me? Yes. What is happening versus what could happen. Make a difference? This could turn to airway. Is it yet? No. This one is short of breath and is wheezing. Is this one exacerbating or having exacerbation? Yes. So now I pose the question again. Do I keep 4 or do I keep 3? I'm just comparing 2. Now we're going to go 4/3. So if you notice what my students do, they go 4/3 or 4/3, right? Because I just want you to make a decision. You know why we do this? And this is called Dr. Zishan's method. Why do we do this? Am I going back to 3 and changing my answer? No. Do you know how many people would go back and be like, was it peanut? Was it not? Was it peanut? Was it not? And they sit there, and I'm guilty of it. Do you know how many times I would change my answer and they tell you, well, wait a minute, why did you change your answer if you eliminated it? Use the method. Use the method. If you already chose 4/3, you're not going back and changing it. Fair? Now, we're going to compare 4 to number 2. A patient with a history of hypertension presenting with a blood pressure of 200/110, but no other symptoms. 200/110. Could they develop a stroke, altered mental status? Could they develop a brain bleed or a hemorrhage? Could they? Could the hives turn into airway? Could they? Yes. But do they? No. So you see, I want everyone in here to write down 2 sentences. I want everyone to stop and take a moment right now. I want everyone to write down 2 sentences. Who do I have more time with? Prioritization. Who do I have? You're doing Ask Graph for sure. Who do I have more time with? Sentence number 1. Who do you have more time with? Sentence number 2. What more would I do? What more would I do? Okay, so let's go through this. Between a patient that is having exacerbation I'm glad you like it. Welcome. So, for a patient that is having COPD exacerbation, what am I going to do? I'm getting ready to save their airway. Intubate, sure. Trach, maybe. Start meds right away, for sure. With blood pressure, okay, they got 200 over 110. Now let's do a little bit of farm. You see how many things I'm about to bring in here. Okay, give antihypertensive. What's a great one for acute hypertension, elevated blood pressure? In this situation, what's a good drug? Let's do some farm real quick. Not prills. I need it to work like this. Not beta blockers. I'm gonna do some farm. Clonidine. Excellent job. Clonidine. In this situation, you think I'm just gonna monitor them? That'd be a great least invasive thing, but a little bit too elevated, right? They're at risk for a stroke. They're at risk for a bleed. They're at risk for hemorrhaging. So I want to get this blood pressure down, even if they don't feel anything, because what could happen? So the drug I'm going to talk about real quick, see how I go from one topic to the other. This is just about prioritization and ask graph, but now I'm throwing in farm. Do you think this is how you need to learn? Medicine is medicine. Yes. Clonidine. Why clonidine? Clonidine drops your blood pressure like this. Other drugs, calcium channel blockers, prills, beta blockers, do they come down real quick? They take time. They take time, right? Phentylamine is for hypertensive crisis. Another drug you should know, but we talk about that in mental health. So, but good recognition. So clonidine is a great for this patient. They're asymptomatic, but they have hypertension. I can give them clonidine. Thank you. Welcome. I can give them clonidine. So now we're doing a little bit of farm. So identifying clonidine. How many people have watched the 5 ways that farm questions can be asked? If you are afraid of farm, you should be subscribed to our YouTube. You should be on our IG, Facebook, so on and so forth. Because on our podcast, I talk about the 5 ways. Identify the drug. Clonidine. What is clonidine? Clonidine, clonidine. I see it as my answer choice. What is it? Was it? I don't know. I'll choose it. No. Now you know it's used for hypertension right away. Boom. But what am I worried about with clonidine? 2 things I need you to know. Education is in one of the other 5 ways. 1, you're going to taper them off. And the reason why we taper them off is because of what's called rebound hypertension. Meaning, if I stop it abruptly, that 200 over 110 can turn to like 240 over 120. We're on one question. And I've already talked about respiratory. I've talked about anaphylaxis. I've talked about medical terminology. I've already jumped into pharmacology. That's one question. And we're not even done yet. Do you see how important it is? This is why what we do is so different. Because now when you look at a question, you're going to see it. I love that. I love it. I appreciate the compliments. I really do. But yeah, this is exactly how we do things. So now a patient who fell from a ladder. Okay, so we decided we're going to stick with 4 over 2. Have we come to a consensus on that? Cool, perfect. All right. So yeah, but nonetheless, when you're studying for boards, when you're studying for your Q bank, you're going to break things down just like that. I want you to think one step further and one step further. The second point is it can cause rebound hypertension. Whoops, rebound hypertension. Right? So you got to taper them off because it can cause rebound hypertension. 2 things you need to know. Cool. Now I'm down to 50-50. On test day, I'm feeling good. I'm feeling really good. And I'm sitting there, I'm like, all right, cool. A patient who fell from a ladder and is now complaining of back pain, but has no visible injuries. Dude, they fell from a ladder. What if What if they're paralyzed? What if they have a spinal fracture? But Dr. Z, what if? We could play that game all day. Right? Thank you. I appreciate all that. That'd be a rabbit hole, right? That's a great thing to ask in real life. Yeah. Okay. Do they have, they're not indicating that. So we stuck with 4 out of 5. What do you feel? Ask graph. And boom. There you go. There you go. To everyone else, this is going to look easy. Or to you all, it looks easy because you're watching me explain it. When you start thinking like me, I promise you, it's a game changer. How boring was that question if you were to do it like this, like you're studying, you're like, oh, I got to do another question. It's boring. Another prioritization. But now you're like, wait a minute, hold up. All right. Immediate prioritization. Let's find some ask graph. Whoa, they try to get me with the rash. Not quite there yet. Their airways not compromised. Blood pressure, cool. Now I'm thinking clonidine. Wait, do they have anything? Oh, it's altered mental status? No. Hemorrhaging? They could. You see? Now it's a game changer. Now you're kind of like, all right, throw me another one. Let's see. I appreciate the I really appreciate the compliments. Seriously, they're so humbling. Thank you so much. Thank you so much. It's a game changer. It makes it fun. All right, here we go. Let's have some fun. Please don't jump ahead of me. Let's do this together so we all get that learning experience. I'd appreciate that. And I'm sure everyone else would too. So we use the method again. And we start with the last part first because I want to see what type of a question it is. 5 types of questions on this exam. That's it. I taught that before with the traditional, and I taught that with the next gen. There's only 5 types of questions on this board exam. That's it. So which patient should you attend to first? First, initial, priority, urgent, most concerning, immediate, report to HCP. I know I'm repetitive, but look at how quickly I know these 7 words. Right off the bat, prioritization. Which one am I freaking out about? First, initial, priority, urgent, most considered, immediate, report to HCP. You see how quickly it's embedded in my head? It's like knowing lyrics to a song. Literally, it's like learning lyrics to a song. When you start thinking like this, you're going to be like, yo, it's good. Please don't jump ahead. All right. You are a registered nurse working in the hospital. You have 4 patients under your care. All right. Freaking out about. We start with number 4 again, and we compare it to number 3. So again, a 20-year-old male with a minor laceration on his hand, awaiting wound dressing. Have I made a decision about this yet? No. All I'm going to do is take number 4, put it in my back pocket, and compare it to number 3. A 65-year-old female with a history of heart failure due for routine diuretic medication. Ooh. Now, I could say neither, but I have to choose one over the other. Which one am I going to be more concerned about? Minor laceration or somebody with heart failure with routine diuretic? Okay, if they don't have a diuretic, potentially they can start developing that fluid overload, right? With a minor laceration, I've got to debride it, clean it. I got to ask them if they've had a tetanus shot, depending on how they got the laceration. I got to see if they've got any type of, if they need an x-ray. Whoa. That's a lot of stuff I got to do for a minor laceration before I even think about this person being in trouble. Somebody with heart failure without routine diuretic medication, what do we got? What is the point of diuretics? To get that fluid off. Get that. And here we go. With that fluid overload, what's another word for excess fluid? Excess fluid. Good. My students know what question I'm asking. Excess fluid. Edema. So we've got 3 types of diuretics. You should know them. Farm. Know what's used for heart failure. Know it inside out. And side effects. And which one to use. How many of my students know their diuretics inside out? Yes, 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 yes. There we go. 40-year-old male post-operative patient from hernia surgery requesting pain meds. Between 65-year-old with heart failure and diuretics over post-op requesting pain meds. They're not screaming, I've got 10 out of 10. I've got 8 out of 10. No, it's like, can I get some pain meds? Can I get some pain meds? Cool. Not freaking out about it, right? Not freaking out about it. Yeah, I would still keep 3/2. They got time. We can get to them. It's probably wearing off at that point. It's probably not even to the point where it's really painful yet, right? Now I'm down to 50-50. 55-year-old female with diabetes reporting feeling dizzy and shaky. Huh. What could be going on here? Dizzy and shaky. Ooh. Do you think my nerves, altered mental status, dizzy? I'm not feeling. Oh, what's going on? What's going on? Why? Because what do you think happened? My blood sugar dropped. I would take 2 of Asgraf right here. Right? 2 of Asgraf. Altered mental status and glucose. Altered mental status and glucose. 100% I would stick to those. And now I don't even care which one it is. Do I care if it's altered mental status or hypoglycemia? It's the same one. They could have both. They could have it simultaneously. One could lead to the other. Yeah, of course. Sure. Which one is it? Doesn't matter. It's both. So we stick with one. You see how this pans out. Very important to understand the importance of Asgraf and the method. But then, I'm glad. I'm gonna miss you guys. The ones that just got out of my course and the previous courses. I'm so used to seeing you all so often. I can't wait to see you guys pass. So that's the most important thing. Can't wait for everyone to pass. So again, we have a little rationale, but I kind of already covered it. So yeah, I wish everyone the best of luck, of course, and you all will be fine. All right. We take it one step further. First, initial priority, urgent, most concerning, immediate report to HCP. But what if they just got out of a procedure? What if they're just post-op? Now we're going to narrow it down to ASH. Again, we're sitting here and we're looking at it and like, wait, why are we limiting it or it's making it smaller into ASH? Why are we limiting our answer choices? We're not limiting it. What we're doing is we're being effective. We're being effective. Do we have a lot of brain space to sit there for 5-6 hours and go through 150 questions? And then now we got case studies, and now we got bow ties, and now we got the old school select all the. Dude, we don't got that kind of brain space. We got to be effective. So if I see a patient first, initial priority, urgent, most concerning, report to HCP, and I see them and I'm like, wait a minute, all right, Asgraf. But then they're like, well, they just came out of a procedure. Now I'm like, okay, whoop, 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 take it back, ASH. Because airway can be compromised, for sure. Altered mental status, for sure. Sepsis, for sure. Hemorrhage, for sure. Watch how this works out. Because the sentence, the phrase that I came up with was, you don't want your patient to turn to ashes post-op or post-procedure. Post-op or post-procedure. Right? Little things like this, it may sound silly, but watch this work. And start applying it now. All right, which of the following should be assessed first? Boom, I already know it's a prioritization question because I started with the last part. I use the method. You are a nurse in a surgical unit caring for various post-op patients. Whoa, prioritization paired with post-op? I remember Dr. Z talking about ASH. Let's find it. We continue with the method. We start with number 4, and all we do is compare it to number 3. That's it. And again, these are brand new questions. They're not from any Q rank. These are our questions. 35-year-old post-abdominal hysterectomy 12 hours ago, reporting of mild discomfort at the incision site. Okay, no decision yet. Good job. A 65-year-old male who underwent a transurethral resection of the prostate, a TURP, 6 hours ago, now reporting a feeling of bladder fullness, inability to urinate, and a temperature of 100.6. All right, hold on 1 second. Let's go through this. Which one of ask graph am I seeing with number 4? Am I seeing anything with number 4? No. But what about number 3? Sepsis. If I'm not, now here we go. Now we're going to talk about urine, renal. Now watch how quickly I just changed this into renal, because you better know this. Do you know, what if I didn't even put TURP there? What if I just put transurethral resection of the prostate? How many people would pick up on that and be like, that's a TURP, or know what TURP is, but don't know what TURP stands for? Transurethral resection of the prostate. So I went around the urethra and I took out part of the prostate, but now they've got feeling of bladder fullness, right? There's my kidneys, my horrible pictures, my ureters, my bladder, my urethra. If I'm not peeing, guess what sits in my bladder? Urine sits in there. If urine sits in there for 6 hours, do you think it's going to start to develop more and more bacteria? Yes. What do we say about bacterial infections like cystitis in the bladder? It's going to go up, ascending into the kidney. Do we develop pyelonephritis? Yes. Can we become septic? If you don't know this, do you know your renal? No, you don't. Do you think you need to know this? You do. Do you think I've taught you antibiotics to treat this? Farm. Infectious disease. Let's go. Let's go. I want everyone to feel confident. So now we've decided as a whole, collectively, we're going to choose number 3 over 4, because what is this? It is sepsis in the making. We got to be aggressive. Have we made a decision? No, we're going to compare this to number 2. 45-year-old male who had a hernia repair surgery 10 hours ago, complaining of nausea but no vomiting. But Dr. Z, hernia repair, what if they have strangulation? What if they're hemorrhaging? What if? I don't have anything here. 10 hours ago, if they're complaining of nausea but no vomiting, you think maybe their pain meds have worn off? Okay, sure. Pain meds. Now I think about opioids. We think about morphine. We think about bowel slowing down. We think about sedation. We think about respiratory rate. Wait a minute. I just thought about a lot more stuff because I know medicine. But it's not part of ASH. And now I'm down to 50-50. I'm sitting pretty. 65-year-old male who underwent that TURP, or a 50-year-old female post TKR. TKR is what? Total knee replacement. 18 hours ago. Again, look at that word. Requesting. Look at the word moderate. Do you think I use these words for a reason? I do. 100%. I do. So again, we found one of ASH. We found sepsis. Simple. Every single word. Now, if I was like acute, severe pain, unresponsive, what if I said that? What if I changed? Now, this is the way I want you to think. What if I did 18 hours ago, but now all of a sudden, severe pain and unresponsive? Now, which one? Am I going with the sepsis or am I going with the altered mental status? Yeah, now I just changed it up. But wait, Dr. Z, I have 2 of ASH. Who do you have less time with? The sudden onset, severe pain, and unresponsive. I'm supposed to write out unresponsive. You see how I can change it up real quick? I just made a brand new question right there. And I gave you 2 of Ask Graph or 2 of Ash. You see how I just come up with these things off the top of my head? Boom. Boom. So real quick, what is peritonitis? Peritonitis is a peritoneum. And it encases the GI tract and the reproductive tract. Anything that goes wrong in there, we're worried about hemorrhage, infection, so on and so forth. So there you go. All right. Let's get to needs. Needs. Again, something that came up with, and actually we are going to make a modification to this, which we added in last course, right? Needs now has 2 S's. Needs now has 2 S's. How many were in the last course? How many were in the last course? How many remember me kind of sitting there like this? And I had a blank stare in my face. And I was like, wait a minute, we're about to change this. You remember that? I was like, we're about to add in 1 more S. And I was like, no. We're going to add in sleep. Educate all your patients on their needs. When are you going to say the opposite of this? When are you going to say the opposite of this? Nutrition. Do you ever say eat unhealthy? No. Whatever the nutritional diet for them is, it's going to be healthy or it's going to be the best for them. Exercise. When do we say the opposite? But Dr. Z, they got a broken leg. Give me something. But Dr. Z, they're immobile. Do something. Dr. Z, I don't care. Give me something. Give me something. ETOH is alcohol. Am I going to say increase alcohol consumption? No. Am I going to say decrease or avoid? Yeah, absolutely. That whole idea of 1 glass of wine, 1 shot of whiskey, 1 beer is long gone, right? Don't smoke. It's okay, smoke half a pack a day, or a couple of cigarettes a day, you'll be fine. No, I'm never going to say smoke. Sleep. Oh, you know what? Proper sleep is not good for you. No, it is. It's how our body survives. It's like recharging a battery. If you don't recharge it, what good are you? You're not. Your body can't recover. Your body cannot rejuvenate. You need it. All of these things you need. You need. When you say the opposite, let's do a practice question. I know I'm going a little over, but you got to watch this. This one is never wrong. Never wrong. Never wrong. All right, here we go. So again, this is our commitment because we go over and we don't care. We're doing this for you all, right? So we start with the method. Doesn't change. Which of the following interventions should the nurse prioritize in the initial step in managing the patient's risk for developing CAD? So what are some risk factors or interventions I'm due for their risk factors? Again, this is going to be education. So let's find something that we would educate them on regarding CAD. So a 56-year-old male patient comes to the clinic for a routine checkup. His medical history reveals family history of coronary artery disease, sedentary lifestyle, obesity, and drinks 3 to 5 beers a day. Lipid profile shows elevated cholesterol. What am I going to educate them on? Could I start them on a calcium channel blocker, or should I advise them to decrease their alcohol consumption? Which am I going to do first? Initial. I'm going to do 3/4. Why? Here's another thing you need to know. What do I do? Least invasive. Least invasive. I can just tell you, stop drinking those 3 to 5 beers a day and watch to see what happens over calcium channel blocker. Instruct the patient to undergo a cabbage. No, that's our last resorts. How many people remember my coronary artery disease lecture? That's the last resort. We don't want to do that. Statins for cholesterol control. Statins are great drugs. The cholesterol is high, but only if education doesn't work. Good job. Only if education doesn't work, because again, decrease alcohol, work out, eat healthy, get some good sleep. Don't let your blood pressure get up. Don't smoke. Not that it says they're smokers, but again, here you go. Here you go. Again, needs. When do you say the opposite? When you say the opposite. Again, real quick, I will be doing a Q&A real quick after this. But before we do that, you already know what I want. I want everybody's cameras on, because I do this for free, and this is all we ask. We ask this, and we ask you spread our word. Spread our word. I don't care where it is, Reddit, Facebook, Instagram. It doesn't matter. Just spread our word to your student, SNA. It doesn't make a difference. Spread the word to all your fellow peers. And here we go. What's up, everyone? Dr. Z here again for another free weekly Zoom. We got all these beautiful people. We had a bunch of people here. We packed the house with 500 people. We got some YouTube people on there as well too. A bunch of people, all these beautiful people waving at you, because guess what? If you are not here on a Wednesday, what is you doing? Until next week. See y'all then. Take care. All right. So with that said, real quick, those of you that are interested, first and foremost, if I did anything to offend anybody, I apologize. Not my intentions at all, ever. And if I can get better, please tell me how. Just yell at us. It comes anonymously. Yell at us. However you want to get a hold of us. With that said, I did say that I would call people that are interested in the upcoming course on demand, whatever it is. I'm personally going to call because I know people are kind of getting stressed out. 2024 is right around the corner. I will personally call in the next 24 hours, again, for the times that are allocated. So first come, first serve. And then, again, just leave your information on the Google form. Look out for a number that starts with the 725. If I usually don't get a hold of you, I will leave you a voicemail, and then I will follow it up with a text. It will say, hey, this is Dr. Z. So just keep an eye out for it. I will try to get a hold of you. Again, for those of you that are interested in the upcoming course, the live course, on the interested in the on-demand, any portion of it, or that are interested in a re-enrollment, which does have a fee, because we don't do re-enrollments, but it would take a spot to re-enroll. So that's up to anybody that wants to speak to me. By all means, feel free. I'd love to answer questions and guide you. I'm not here to sell anybody on anything, but I can definitely guide you in that sense. So definitely. With that said, we're just gonna power through. We're gonna power through with some questions regarding Q&A, and then we'll call it an evening as well too. So with that said, do I have any questions in? And you can just raise your hand on the chat.
Dr. Z, somebody
Yes.
said, how does one-on-one tutoring work? If you were Brittany, want to answer that?
Yeah, there's Brittany. You are our lead tutor. So tutor. I just made up a word.
So it's really anything that you want it to be. We could come up with, it depends where you're at. We could come up with a game plan, a study plan. We can kind of hone in on something more specific if it's something that you feel like you're weak in. So it's an hour of whatever you want it to be. Honestly, it's whatever you want to cover with us, we will cover. If you need some guidance, we'll help you with guidance. If you need to go over questions, we can do questions together. It's 100% what you want out of it. And
yeah,
it's
I think that's
per hour.
Yeah, and that's the benefit of it. I know a lot of people kind of had this thing about tutoring. Every single person that you're going to meet as a tutor, Nurse Brittany being one of them, they are 100% were in your shoes. They've gone through the course. They work directly with me, and we worked as a team to help you. So whenever you meet with them, it's kind of like you're meeting with me as well too. So it's a great way to get that fine tune of getting ready to pass the exam and or getting started on what you would like to do as well too. So with that said, any other questions regarding the upcoming course or anything like that? Again, this course is for RN and PN. If you wanted to do the on-demand is a great place to start. You can always upgrade. You can always upgrade to the live course. All you got to do is pay the difference. So it's kind of like a payment plan. So it's a great way to get started right away. It is on special. Both are on special. I don't know till when, but I can't imagine it's going to be too much longer. They haven't really given me a date yet.
I have another question.
Yeah, sorry. I have one more thing. Next week, our Zoom is not on Wednesday. I'm actually unavailable on Wednesday. So it's on Tuesday. It's on Tuesday. That's the only time we're going to change it. It's on Tuesday of next week at the same time. And the link, if you don't get our emails, if you don't follow us on Instagram, Facebook, YouTube, again, make sure you do, because we will put that link in at the beginning of the week or maybe end of the weekend. So that way you have it as well too. What is the topic for next week? We usually decide that towards the end of this week. So we have a team meeting and we decide that then. So I don't know yet. But if you enjoyed today, hopefully you'll enjoy next week as well too, and weeks after that. So yes, Nicole, I apologize.
I have a question. I mean, somebody has a question. They're currently still in school, starting their second semester, graduating next December. When do you recommend them to enroll?
Ooh, that's a good question.
Or what should they be using of ours in the meantime?
Okay, free resources for sure. Utilize any and everything that I've already kind of said. The YouTube, Facebook, Instagram. Utilize that. And then once you get closer to graduation, let's put it this way, you've got 2 more semesters. Yeah. So for nursing students, we are in the process of making stuff for nursing school. We do realize that nursing school, unfortunately, may not have the ability to teach as in depth as we may be able to. So we're going to be doing certain classes. Myself and the team are working on that. So keep an eye out for that if you're a nursing student or nursing students. So if you like the way I teach and the information and the way that we break things down, you will definitely love that. In the meantime, utilize our free resources. If you've got the means and you've got like the time to do some practice questions, I do recommend using a QBank and purchasing like the year subscription, which if you break it down, it's not too bad. Archer is a great one. UWorld is a great one. We have no affiliation with either. So, there's no benefit of me recommending, just like our testimonials. They get no benefit of aside from sharing. I love QBanks. I think starting with practice questions and seeing a few a day, using the method, applying some of the things you learn from our free resources is a great way to get started.
I think Nurse Kylie has a question.
Okay, can we unmute Nurse Kylie?
Yeah, I just asked her.
Perfect.
I've been doing the on-demand version. I bought it like in November, the end of November for your Black Friday sale. And I've been like daily like videos and everything.
Good.
My only problem I would ask is like I haven't been able to do like the 440s. And would you say that would like affect me going into like my tests? Because I do take my test like sometime in January, but I have been doing either 2 sets of 40s or 3 sets of 40s.
Okay, so this is a great question. 440s, the idea behind 440s is not necessarily you have to do it every single day or you have to do it. You should be able to, the idea behind the 440s or taking 340s and next gen is what we've kind of changed it to, is having the ability to have stamina. That's it, exactly. It's stamina. So if you're studying for 4 hours and then giving me 2 sets of 40 questions, well, then are you not just sitting there the entire time for like 6 hours, 7 hours? You've built the stamina at that point. So the objective is to build stamina. So 440s is just one way to do it. But if you're sitting there studying, taking breaks, and you're just focused and you're not sitting there doing one of these, where you're like, okay, I'm studying for now, and like 30 minutes later, you're like, I just watched 100 TikToks. So no, definitely don't want that. But if you're sitting there focused, again, definitely on there. 440s are on YouTube. So if you don't know what the 440s are, they're also in our on demand as well too. So that's definitely what that is. Cool. Who else do we got?
I have another question from somebody.
Yes.
Should I take the live course if I'm testing at the end of February?
Yeah. So that's actually, if you are to start with the live course, and the reason why I say that is because you're going to be able to check in with us as you get done with the course, and as you start finishing as you finish your QBank, you're going to check in. So if you check in with us, then we can give you an idea of that, if that test date is actually good for you. I think a lot of people don't realize that they have a test date in mind, but it may not be the right test date for them. We kind of heard that with some of the students today, like Nurse Mariama, who said, you know what, look, at the end of the day, like, don't compare yourself, or don't like put that kind of pressure on you. When you're ready, you're ready. So end of February, that gives you plenty of time as well too. Re-enrollments are limited spots. I apologize. We only allow a certain amount of people for re-enrollments as well too. So if you've been in a course prior to and you want to re-enroll, there's only limited spots that we're allocating for re-enrollment as well too. So cool. Hopefully I answered that question. Any other questions that I can address, or any other concerns or anything? How many spots? I don't know how many are there. Aren't any for free. Re-enrollment is a paid one. For people that feel far removed. I think you'll be fine though. So any other questions? Nicole, anything that I'm missing? Sorry.
This is actually a good question, kind of not course related, but we do talk about it. Do you recommend going to the same place to take my test, or go to a new one?
That's a really good question. We should probably make this into a podcast.
Yeah.
We should do a podcast just on repeat test takers. I think that's a really good one. Just to kind of give advice on what to do. So with going to the same location, look, if you this is what I look at when I go to a location: how crowded it is. Okay, so when I took my third set of boards, I took it in Chicago, like literally downtown Chicago. I mean, there were like hallways, number 1, 2, 3, 4, and people had to line up, and you got to get checked. Like, same thing you guys have to go through. They check your glasses, they make you pull your sleeves up, they pat you down, open your little pockets, look onto your big pockets, turn around, get wanded, to do your thumbprint. Look, if you got like 50 people ahead of you and 50 people ahead of you, that can get that can build on your anxiety. I found one here in Vegas, and I actually ended up failing that one in Chicago. So I ended up finding a testing center here, which I took my first set of boards, and I just came back to Vegas, and I was like, you know what? This testing center, the bathrooms are close by. There's a Starbucks right nearby, so I can go pick up my tea and my breakfast sandwich or whatever snacks I want in the morning, keep it in my locker. It was clean. It was quiet. The staff was friendly. So it depends on if you like that facility or not. If you're superstitious or not. That just comes up to, because I passed all 3 of mine at the same testing facility, and I tried to do it at a different one. When I took step 1, I failed. I tried to take it again on my third set of boards, and I failed it in Chicago. So you can imagine I came right back to this, a little bit of everything: comfort, superstition, whatever. So yeah, definitely look at that. The last thing you want to do is feel uncomfortable or feel anxious, feel like just not feel very calm. And it should have a good feel to it when you go to the testing center as well too. Anything else? Everything that we teach already incorporates next gen. Everything we teach incorporates next gen, and brand new next gen questions, things that we've made up, that are board style questions, bow ties, things of that nature. Yeah, we definitely hammer in the next gen, because we're starting to see people get more and more case studies. But again, the case studies are just the same 5 types of questions. So don't overthink it. Any other questions? Today? If you have exam in 2 weeks, utilize the free stuff. Get on that YouTube, get on that podcast, get on all our free stuff, and as well. So make sure, and what's it called? Oh, yeah, 2 weeks. The only other thing, if you really wanted to cram in some stuff, which is really cool, is that $99.99. It's like a 10-day. How many days is it?
Sorry, it's 21 days. The 99,
20,
right?
99. It's like 10 plus hours, give or take. Yeah, it's about 10 hours. So that's like a kind of like cram with some big topics in it. It's got a lot of different ways of me showing you how to do questions. But again, if you're looking for some stuff, great stuff, YouTube, podcast, just subscribe, and you'll see things pop up, because we're putting up stuff all the time. So again, On Demand does have has a next gen on it. It does. Cool. All right. So again, if you have any questions or anything that you want to talk to us about, just make sure you email us with your information or fill out that Google form. And we're going to try and contact you within the next 24 hours, but we'll try to get a hold of everybody before the weekend. And then again, we do run regular business hours Monday through Friday. Again, New Year's coming up as well to consider that a holiday. So with that said, again, for people that are interested in on-demand live course, re-enrollment, whatever it is that you want guidance with, just please let us know. And I will personally try my hardest to reach out to you, and I will get around to most of them. And again, I will leave your voicemail if you have a voicemail. If you don't, then I will leave you a text message letting you know it's me, and then you can schedule a call back with me as well too. Cool. All right, everyone. I thank you for your time. There's Heidi. Thumbs up. Love it. I got you. 2 thumbs up. With that said, everyone, have a wonderful, wonderful evening. I will talk to you or see